Hello everyone, my name is Richard, reg number 090, and I'm going to talk about the database management systems project where I focused on the patient record management system as I'm going to talk about it here. My area of interest was healthcare, and in healthcare we have very many healthcare systems. We have the patient records management system, vaccination and immunization management systems, logistics management and information systems, pharmacy and regulatory systems, mental health support and referral systems, healthcare insurance claim systems. The reason why I chose this system is because there is need to have quick access to patient information, data safety and privacy. There is also need to improve patient care and continuity or safety. As you know, there are very many patients who can carry their documentations for the previous medication or treatment while going to a given hospital for treatment. So this system will cater for all that. There will be no need for the patient to carry all those documents as the system will avail all the necessary information. As we move on, there is I have the objectives for this system, and the main purpose is to revolutionize healthcare information management. It will replace the manual paper-based systems with a comprehensive digital solution, and therefore it will enhance patient care, operation efficiency, and data security. The key features here: centralized storage of patient data, streamlining appointment scheduling and management, and there is also insurance information verification and management. So it will be easy to determine which patient and which insurance company provides a given policy to a given patient in case that patient has a given a given health insurance policy that covers for his treatment. So we have the business case and user groups. These will be the system's tasks. It will store and retrieve patient demographic information, recording of patient medical history, tracking of patient visits, scheduling of appointments and follow-ups, management of prescriptions. The user groups, we have the patients, medical professionals, administrative staff, insurance providers, and the pharmacy staff. And these are the benefits and the costs, and I've tried to make some analysis on them. We have the tangible benefits. There will be less paperwork and storage costs, improved billing and accuracy, fast record retrieval, and we have the intangible benefits, improved care coordination between the care providers, enhanced patient experience, more informed clinical decision making. And there are also tangible costs, database software licensing, server hardware, data migration from the manual to the new system. We have staff training. There is also intangible costs, temporary disruption during implementation, time required for the staff to adapt to it. There is also potential resistance to change. Uh, these are some of the user issues. Medical staff will require training. The system will be intuitive enough to minimize uh, cognitive load during patient interactions. So, no matter the size of the data that will be fed into the system by many patients, the system will still be able to handle this. We have the assessment of the risks, and we have three categories. We have the technical risks, organizational risks, and the regulatory risks. And there are also some system limitations, data entry errors. However much the system will be virtual, but still it will depend on human input of data. There is limited access to technology, especially for those health centers in rural areas. There is also user training required, especially for staff. The initial setup cost in buying the software hardware will be high. There is also limited online functionality as the system is designed basically to work online. So without network access, someone may not be able to use the system. These are some of the entities, or these are the entities that will be in this system: patient, doctor, nurse, appointment, medical record, prescription, medication, department, and insurance. I also have some relationships between different entities. We have the patient has appointment, which is one to many. Doctor conducts appointment, which is also one to many. We have prescription conducts medication. This one is many to many. Doctor writes prescription. It's also one to many, as a doctor can write many. One doctor can write many prescriptions. As we move on, this is my entity diagrams. It shows it uses the foreign keys to determine different relationships between different entities. And we can see a patient can have many patients can have one insurance policy. Uh, one patient can have many appointments. One doctor can conduct many appointments with different patients and many others. This is the user interface where someone will be required to enter his credentials in order to use the system. And there is someone who doesn't have an account will be required to register or create an account in order to use this system. And this will be the dashboard when someone logs in successfully. And you have the patient, we have the main dashboard, you have the patient profile, appointment scheduling, as it's shown on the picture on the right side, on the right side, on the left side, sorry. As we move on, we have the patient record management system. We have some pictures here showing the medical records in the of given patients in the patient record management system. We have the patient profile. Then I moved on to the implementation. I was able to implement this database using MySQL. These are some of the attributes for the different entities that I talked about earlier. Then I was able to create the database schema, and I created this database and I named it patient record management system, and I was able to create some tables for different entities, and I also managed to describe them or show them up here. Then I was also able to load some sample data into these tables as shown here. Then I was also able to create some sample queries, and also they provided some results. There was a query that was counting the number of patients associated with each insurance provider using left join between the insurance and patient tables. There is another one that counts the number of doctors in each department. It's also using left join. There is another one that retrieves the appointment details along with the patient names and doctor. Then the purpose. Here I used multiple joins, left joins. It's also it is listed here. Then these are some of the references used two textbooks. One is called Database Systems. It's a practical approach to design, implementation, and management. Sixth edition by Thomas and Caroline Beggy. There is another one by Henry F. Coth, and also some tutorials from YouTube. And uh, in conclusion, this system is aimed at designing, implementing, and testing database mail system in the healthcare sector. This system design uh, addresses many challenges faced by healthcare providers in our country. As you know, our country is still at its early stages of development. So, through automation and centralization of patient data, the system supports better decision making and improved healthcare delivery in our country. Thank you for watching. Remain Richard with number 090.